Joining me now is Professor David Walker, the Deputy Chief Medical Officer for England. Many thanks for joining us this evening. Why are you targeting these viruses in particular?
Well, these programmes have been a long time in preparation. It takes several years to accumulate all of the evidence and prepare the programmes ready to go. So we've really produced these programmes in response to the evidence and the developments over the last few years, but it's a very exciting time for immunisation.
And after the MMR jab was wrongly linked with autism, parents have been particularly anxious about getting small children vaccinated. Can you assure parents that these new vaccines will be safe?
These vaccines have undergone extensive safety testing, and all of them are already in use in other countries, and we've had absolutely no problems with safety at all. So we're very confident that these are very safe, very effective vaccines which will produce tremendous benefits for young children.
And the flu vaccine for 2-year-olds, that was due to be rolled out next year. It's been brought forward. Is that a direct result of what's happened in Swansea with this epidemic of measles breaking out?
No, the two things are completely unrelated. The programmes take a long time to prepare, so it just so happens that we were preparing to do this anyway, and the measles outbreak occurred at the same time. OK. And would I be right in thinking that 90% of people have to take up vaccinations of a particular illness or disease in order for it to be effective? Is that right? Well, the higher the uptake, the greater the immunity in the wider population, the so-called herd immunity. And we're not just protected by the vaccines that we have ourselves, but also by the fact that everybody else is vaccinated around us. And so the disease can't spread because there aren't any susceptible individuals. So really, we want the levels to be as high as possible. But certainly, if we can get levels up to about 95%, we know that outbreaks are very unlikely. And if the take-up isn't high, is that just a waste of money? No, absolutely not. Those people are still protected. But if we get lower levels of uptake, then there will always be a small proportion of the population who will be susceptible in the future. And that's really what we've seen in Swansea. You know, the MMR immunisation levels in Swansea are now very, very high in the target population. But there's this group of people who were not immunised a few years ago who remain susceptible, and that's where the outbreak's occurring. And how much is this programme going to cost us? And most importantly, can we afford it? Well, yes. The immunisation programmes generally do cost quite a lot of money because they cover so many hundreds of thousands of people. But, for example, the rotavirus programme that you talked about is going to cost about £25 million. But we expect that with the reduction in the number of children being seen by GPs, the reduction in the hospital admissions, that actually that'll save the NHS money in the long term. OK, Professor David Walker, many thanks. Thank you very much.